The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Find relief from your heartburn with Mastica Kios. Made with mastic gum, this supplement has been shown to be useful for fighting gastritis and heartburn, as well as overall gastric and intestinal inflammation. Studies have found that supplementing with mastic gum not only relieves symptoms of these painful conditions, but can actually help with healing the stomach while preventing the growth of harmful H. pylori bacteria. AOR's Mastica Kios is derived exclusively from mastic gum from pistachio trees to help relieve your symptoms while healing the root cause. Get yours today at your local retailer or online at aor.ca or aor.us. Welcome to another episode of Supplementing Health. Today, Dr. Lara Spector, naturopathic doctor, is joining us to discuss the details of heartburn. Dr. Spector helps her patients achieve wellness by addressing the root cause of their imbalances by using evidence-based therapies and natural forms of medicine. Thanks for being here today, Lara.
Oh, it's my pleasure. It's great to be here.
So heartburn is one of the most common digestive disorders affecting North Americans. I've seen numbers that estimate nearly 1 in every 4 Canadians experience heartburn on a regular basis. Do you think this has become more prevalent in recent years?
Yes, it definitely has been documented to be more prevalent as well. Due to obesity and people being overweight, more being on the rise as well, it tends to increase heartburn prevalence. That one definitely is the biggest factor that we've seen just trend across most countries.
And so what exactly is heartburn?
So heartburn is actually a symptom, which basically means burning where the heart, we all associate where the heart is. So it's actually not a condition, it is a symptom.
Okay, and so I've also heard heartburn referred to as acid reflux or GERD, which is gastrointestinal esophageal
I know it's a hard one to
reflux
say.
disease.
It's a mouthful.
Butchered that. Are these conditions actually all the same thing?
Pretty much. Well, basically, acid reflux occurs when stomach acid backs up into our esophagus. Typically, we just have stomach acid in our stomach, or we're meant to, at least. And so heartburn is essentially a symptom of that acid reflux happening. What gastroesophageal reflux disease, or GERD, I like to call it, is it's a more severe form of acid reflux. So typically when you have acid reflux more than 2 to 3 times a week, it would be classified as GERD. So heartburn essentially is a symptom of both acid reflux and GERD. It tends to be more severe with GERD.
Okay, and what causes GERD or acid reflux?
So a lot of people assume actually that acid reflux or GERD is caused by too much stomach acid production, but really what it is basically stomach acid coming up from the stomach into the esophagus. Typically there's a sphincter, well, all of us have this sphincter called the lower esophageal sphincter that basically connects the esophagus to the stomach. And majority of the time it is closed except for when there's food being ingested. and that allows for the sphincter to be relaxed and for food to go from the esophagus down into the stomach. What can happen is that sphincter can become more relaxed, which allows for stomach acid to actually travel upward from the stomach into the esophagus. So that's what the acid reflux is pertaining to, reflux of the acid from the stomach into the esophagus.
So are there ways to strengthen the sphincter then? Like if it's becoming relaxed when it, in theory, shouldn't be?
Well, exactly. So the key is to get to the root cause of why it's not functioning optimally. And again, most people do think it's too much acid that is causing that sphincter, to not work, or it's just sort of spilling over. But actually what it comes back to is a little bit deeper than that, not actually having enough stomach acid in the first place. And when you don't have enough stomach acid, it allows bacteria to overgrow in the stomach. And what that can cause is basically fermentation of carbohydrates by bacteria, and that puts extra pressure on that sphincter, which causes it to malfunction. So it's a little bit sort of more complex, but ultimately it actually comes back to low stomach acid in the first place that causes that sphincter to malfunction.
So then regular use of antacids probably has a fairly large impact on regular heartburn, and I'm guessing does not help to heal the root cause.
Well, exactly, yeah. So if anything, it actually lowers that stomach acid even more, which is why people tend to rely on these medications long term. What they do work on is symptomatic relief of, acid being present in the esophagus, right? Which, is causing the heartburn, but you have to get more to the root cause, which is the low stomach acid being produced in the first place. But in order to, sort of get someone feeling better right off the bat, definitely antacids would do that. But you do want to work deeper on that root cause and try and avoid antacids and use alternatives, because they do have other effects as well, not just overall lowering stomach acid long term. They also have increased risks and side effects long term.
Okay, so if someone is suffering from heartburn, but they don't want to be taking those antacids to perpetuate the issue, what are some of the things they can do to start reducing that inflammation and start on the healing track?
Right, so there's a couple options. One of the most studied one is DGL, or deglycerinated licorice. Sorry, it's a mouthful. So it's actually been studied to be effective in treating gastric and duodenal ulcers, and actually one study has been shown to work as well as Zantac with none of the undesirable like acid suppression side effects. So it helps to promote mucus secretion and is anti-inflammatory. The other option is zinc carnosine. So it works well also as an anti-inflammatory and helps to protect the mucosal lining of the esophagus. There's also mastic gum as well, which has actually been used since, traditional Greek times over 2,500 years ago to treat peptic ulcers and gastritis. It also has antibacterial effects against H. pylori. All of these are wonderful. Of course, work with your practitioner to see, if any of these are okay for you and to get the go ahead. But yeah, those are some good alternatives to antacids for sure.
That's good to know. So then when should someone experiencing regular heartburn seek help from a medical professional?
So basically, I think anyone who's experiencing heartburn should seek help. But if we're talking about more serious help, if you're experiencing sort of a severe chest pain or pressure, especially when there's other things going on, potentially like pain in your arm, like the left arm especially, or pain in your jaw, or any difficulty breathing, shortness of breath, you want to obviously rule out a heart attack. That's number one, right? So a lot of people can get freaked out when heartburn happens. And if you're experiencing any of those symptoms or a more severe form of heartburn, definitely right away go to the ER to rule that out. But if you know for sure it's heartburn or acid reflux, then typically if it's happening more than twice a week, you do want to seek help from your doctor or a naturopathic doctor.
Okay, cool. And what can happen if it's left untreated?
Well, left untreated because of the reflux of stomach acid in the esophagus, which really the esophagus isn't meant to have acid in it. It's meant to, because the lining of the esophagus is not like the stomach. It doesn't have a protective lining that protects it from the acid. So over time, if you're not addressing the acid reflux, the stomach acid can damage the tissue lining of the esophagus, and that can cause inflammation, pain, ulcers, and eventually down the line, it can actually lead to permanent damage of the esophagus and potentially even esophageal cancer.
Oh, wow, that can be very serious then.
Yeah, exactly. Always good if you're feeling a symptom to get it looked at, that's for sure.
Yeah, absolutely. Now, earlier you mentioned that excess weight and obesity has been playing into the increased epidemic of heartburn that people are experiencing. So can you explain what role weight actually plays in heartburn?
Yeah, of course. So because when there's more weight, it can cause more abdominal pressure because we tend to put on that weight in the abdominal area. It can actually put pressure on that specific sphincter, the lower esophageal sphincter, and cause it to malfunction. And that can cause the stomach acid to travel again into the esophagus, causing that symptom of heartburn.
Right. And does age or gender play a role in whether you're likely to experience heartburn?
Yes. So as we age, we do get a weakening of muscles in general, but because the sphincter, the lower esophageal sphincter, is also a muscle, it can also weaken with age. So it actually tends to relax more. And not just around the time that we're eating to allow food in, it can relax, even when we're not eating as well. So it can allow for that stomach acid to escape into the esophagus. The other factor is that we actually, as we age, we decrease our stomach acid production. So they actually did a study in the elderly, and they found that basically 80% of women over 80 years old were not actually making more than 5% of the stomach acid that they would have like in their 20s. So really there's a huge reduction in stomach acid. And again, if we go back to that root cause of why the heartburn is there, it would make sense why it increases with age. The other factor, I think you said gender, correct? Yep. So
Yes.
gender. So typically, actually, women experience heartburn more than men. More men experience sort of the erosion of heartburn, meaning like the more serious effects of heartburn. And I think that comes back to men maybe not going to see their doctor as often as women do. But women tend to experience more heartburn on a regular basis. And it's interesting because it's women typically over 50, which has to go into the whole age phenomenon. But there is a role of estrogen and how it's an anti-inflammatory hormone specifically for the esophagus. So when women run lower on their estrogen, they tend to experience more heartburn, which typically happens after menopause, which is around 50.
That's very interesting. Hormones play so many different roles in the body. It's amazing as you learn all the different things that the same hormone can do all over the body.
Oh, for sure. We definitely underestimate our hormones, that's for sure.
Right. And you had mentioned that the low stomach acid can lead to bacterial growth in the stomach. So is that bacteria such as something like H. pylori, and that's why ulcers occur, or is there other bacterias that are growing?
So yes, H. pylori is definitely the most common one. I was also referring, sorry, to bacterial overgrowth that can occur in the small intestine, which is just right below the stomach as well, which can also cause increased pressure on the stomach and the lower esophageal sphincter. But yes, H. pylori tends to overgrow when there's not enough acid in the stomach. So H. pylori basically it doesn't like an acidic environment. It tends to grow in a more alkaline environment or a higher pH environment. So when stomach acid levels are low, it can increase the pH in the stomach, allowing for that H. pylori to overgrow. And yes, H. pylori left untreated can result in ulcers in the stomach. So it's definitely important to address H. pylori if that's happening, but also address the low stomach acid as well so that you prevent it from continuing to happen.
So what kind of things can you do to address low stomach acid or increase the production of stomach acid?
So if you are experiencing heartburn, you actually don't want to work on stomach acid right away, because a lot of the things that increase stomach acid can right away can sometimes worsen heartburn in the moment. So first you actually want to work on calming inflammation in the esophageal lining caused by stomach acid being there in the first place. But after you've done that and people are starting to notice potentially their heartburn has come down a little bit, then you can start to work on the root cause, which is the low stomach acid. So things that I find work really well for increasing stomach acid are bitter herbs. So you can actually, purchase from the health food store a combination of bitter herbs. Can be herbs like wormwood and gentian and berberine. They often come in a combination. Often we're not eating in sort of the right state of the nervous system. So what that means is we want to be in the parasympathetic dominant form of our nervous system when we're eating, because that's when all of our stomach acid is being produced, as well as other digestive enzymes. So what I often suggest is taking 3 deep breaths before a meal to just really get your nervous system into that parasympathetic state. Also avoiding consuming liquids with meals so it doesn't dilute the stomach acid. Apple cider vinegar before meals as well can be really helpful. And then you can actually take hydrochloric acid hydrochloric acid and stomach acid are the same thing. And you can take that actually as a supplement. But again, you don't want to do it until after you've sort of calmed some of the heartburn.
Okay, so then speaking about the nervous system, do anxiety and heartburn often go hand in hand then, or is there a link that exists there?
Yes, definitely. I've seen it across the board, especially with patients. Stress and anxiety are a major trigger for heartburn. And it actually comes back again to that low stomach acid. So when your nervous system is in more of the sympathetic state, where that's the fight or flight state, that, the more adrenaline producing, always sort of flying at the seat of our pants, that's when all of our blood flow is going to our hands and feet, essentially to keep running from that bear. So if we're constantly in that state, we're not concentrating blood flow in our abdomen, where we can produce that stomach acid and those digestive enzymes to help actually digest our meals. So over time, if we remain in that sort of anxious or stressed out state, we can end up with really low stomach acid, which can definitely contribute to heartburn.
Okay, and some people use like alcohol or even sugar to help kind of cope with stress. Can these exacerbate the issues, or are there other foods that make heartburn worse or trigger it?
Oh, definitely, unfortunately. So yeah, specifically alcohol, it can directly damage the lining of the esophagus and the stomach. So definitely, again, worsening that heartburn. And then there's other foods. You mentioned sugar, gluten, dairy, spicy foods, citrus foods, tomatoes, coffee, peppermint, and chocolate are the ones that tend to worsen heartburn the most. So I typically try and get my patients on a more sort of bland diet. I know it doesn't sound as fun, but trying to stick to, whole foods and trying to cut back on stimulants like coffee and alcohol, which tend to have a negative effect on our nervous system anyway. So trying to work on the diet to really calm things down, not forever, but just in the beginning as we're working on trying to get to the root cause.
Peppermint actually really surprises me because it can often be used for indigestion, right? You can get like peppermint supplements or there's lots of suggestions to use peppermint to calm down the system. So I'm surprised that it actually can trigger heartburn.
Yeah, so specifically, it can actually relax the sphincter more in between the stomach, the esophagus and the stomach. So it's great for IBS. It's great for, if you have lower digestive issues, but if you have heartburn, it would definitely not be one of my first herbs to go to.
That's great. Very good to know.
Mhm.
And for women, some of them experience increased heartburn during pregnancy. Is this again due to increased pressure in that area, or are there other reasons for that?
Exactly. So it's because of the increased abdominal pressure. That's just basically pushing everything up and essentially relaxing that sphincter more and allowing for that stomach acid to travel up into the esophagus.
And are all the herbs and suggestions you made safe for pregnant women? Because I know a lot of natural supplements actually aren't suggested when pregnant or conceiving. So would they be able to still treat their heartburn in the same way?
No, so in women specifically, I would not be using specific herbs like bitter herbs or stomach like acid, like the one I suggested, the stomach acid you can get in a capsule form. I'd be using things like probiotics to help balance that bacterial overgrowth that typically is happening. I would also recommend magnesium because magnesium can help with just motility more as well. And then specifically calcium with magnesium especially can be very soothing for the esophagus. So taking some like a calcium magnesium liquid, especially at night when women tend to experience heartburn more from pregnancy, it can be really calming at that time and before bed. And then also just working on all of the sort of lifestyle pieces. So with the diet, for example, trying not to eat too much at once because that will, eating smaller meals will help with the heartburn because it's less food the body has to process at once, or the digestive tract has to process at once. And then also trying not to lie down, of course, right after a meal is really important, waiting at least an hour or two before going to bed. And yeah, those are sort of the big things that I would suggest for pregnancy.
That's great. And why is it that some people experience heartburn more at night than other times of the day?
Right. So typically at night, that's when the sphincter tends to relax more. At the beginning of the day, that's sort of when our muscles are most toned and more active. And then by the end of the day, that's when they tend to relax more. And then also, it tends to be at the end of the day, that's when our stomach acid production is the lowest. So it has to do with the muscles and the lower stomach acid levels.
So are there certain nutrients or supplements besides like the ones specifically treating the heartburn that someone should be incorporating in their daily routine to help kind of prevent heartburn down the line?
For sure. Well, I mean, I think probiotics are a huge one because they'll help basically balance bacteria in the gut. So to prevent an overgrowth of certain other bacteria that can, worsen heartburn if you have low stomach acid. I think, being aware of, stress levels and taking any supplements to help support that, because like we mentioned before, stomach acid production can go down with stress. I also think, apple cider vinegar and lemon and hot water are all excellent at helping to increase stomach acid naturally. And yeah, the other thing I would suggest too is if you already know that there's, a bit of a weakened digestive tract, and you're wanting to prevent heartburn down the line, bitter herbs can be really helpful too, just to take before dinner. The reason I'm saying dinner is because, again, that's at night when we have the lowest amount of stomach acid being produced. We want to actually increase that output at nighttime.
Right.
And that's
Okay, yeah, that totally makes sense.
yeah.
Um, And one last question, and it kind of ties back to what we were talking about with like sugar and alcohol and all of that. But why is it that fast food tends to trigger heartburn for a lot of people?
So typically with fast food, you're combining a lot of different food groups in one. The biggest one with fast foods, are those oils, those refined oils. And typically you're blending that with a protein like chicken or beef. And it's the combination of those foods that tend to really have a negative effect on our digestion. It's very hard to digest at once. So it just puts a lot of pressure on the digestive tract and can cause, that sphincter to relax even more, to react even more, to allow that acid to back up into the esophagus.
Okay, well, this has been fantastic. I can think of several people I want to share this episode with already. So
Awesome.
thank you for taking the time to share all of your insights with me.
Awesome.
If listeners want to work with you or get a hold of you to get additional information, any of that sort of stuff, how would they go about doing that?
Yeah, so they could access my website at www.laraspectornd.com. And I do work in 2 clinics, and I do online consults as well. So they can just contact me through that website if they have any questions or if they'd like to book an appointment.
Wonderful. Well, thank you so much for joining me today. This has been a riveting conversation, lots of great information, so I really appreciate it. And thank you to the listeners who have tuned in today for another episode of Supplementing Health.
Awesome. Thank you so much.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.